sadness. Hey, Joyce. Hi, Marilyn. Go for it. Rant away. It's a sad rant, but a rant nonetheless. Okay. Good afternoon, everyone. Thank you, everyone who tuned in last week for Cancer Week. And I know it was very nice that you could all expect us at the same time every day at 10:30 a.m. I'm just finding that my days are so busy. I have like 8 hours of stuff already scheduled on tomorrow's calendar. It's crazy. This is retirement. So we're going to be, since it's not a focused week, we're a little bit all over the place, but tomorrow I will be here at noon with Billy Hookman, and he's going to do a presentation for us called How I Feed My Dog. And so those of you who know Billy know that he had his little pug Lua for a very long time, and he took great pride in posting Lua's meals, and they were always creative and wonderful. And Lua has passed, and he now has a French Bulldog puppy. I think he only has one, but I think there's a second one coming. So I'm really interested to see how he is feeding and playing with the food for the puppy. And he's brilliant. He loves to research food and play with food. So that should be great tomorrow at noon. I don't know what we have on for the rest of the week. I know Gwen has a special segment tomorrow morning at 9 a.m. Eastern with Paul Dega, which is running a pet business ethically. That one you do need to sign up for. So if you've seen the post for that, you do need to register for that. And if you register but can't be present, then the video will be sent to you later. So I've been emailing back and forth with a pet owner, and I told her, I don't know if she's watching, but I did tell her that her story was going to be on Facebook Live because, yeah, I don't know how we ever worked. That's what my mom said when she retired. But I told her I was going to use this story because it was so sad to me that I actually sent it to everyone on our team when I got the email. And said, this one makes me want to cry. It also makes me very angry, which, if something makes us cry and be angry, that's what drives us to keep doing what we're doing, because it's so important that we keep educating you guys. So she had originally written to me, and she sent me a picture, cutest little dog, and he only has one eye. So I'm going to read her email, and I'm going to not use the names. She said, I'm so thankful for the information you share and everything I've learned from you. My dog is still here, and I have you to thank for that, as I believe the care I provide has enabled him to live past the 3 months he was given last August. So we're 3 or 4 months past his given expiration date. Love it when we pass those. She said, I have had some time now to calm down, get a grasp on his health and my state of being. I'm taking advantage of the time we have instead of dreading what is coming. We have switched healthcare again from the integrative TCM practice to a hospice vet that comes to our home, which is a great idea. The integrated practice never came close to providing the information and knowledge that you do. However, they did tell me that he's an earth dog. I'm so grateful to you. Thank you. We have an appointment this Wednesday with hospice to determine if his right-sided heart failure is acting up. He was just, his furosemide, Lasix, was increased to 30 milligrams a few days ago after a little scare. May I ask your opinion on his current regime? And she gave me his drugs that he's on and supplements that she's using. And then she also has pain meds because says he has undiagnosed pain that has him crying for up to 20 seconds sometimes, which is very sad. So he had this eye removed a few years ago, and that's the first part of the sad story. She said, I feel so awful that I wasn't able to fix his eye. The doctor that performed the enucleation, the eye removal, said the procedure was fairly straightforward. The tricky part is getting all of the tissue. She clearly didn't, and a couple of years later his eye swelled up with tears, so it filled with fluid. The first time he was in a lot of pain. The doctor pulled out a needle and syringe and wanted to stick it right in there, but I requested that it be put under because of how painful it was. In the end, I was advised against surgery and to have the eye drained as needed almost 5 years ago now. Please know that his eye never caused him pain after that first drain. If it were painful, I would have had the corrective surgery right away. I was finally in a position to have a specialist, an ophthalmologist, see him and finally have his surgery when we ended up in the emergency room with end-stage heart failure of both sides. He's obviously not a candidate for anesthesia anymore. I hate that I wasn't able to have his eye repaired. That is how we ended up at large corporate practice, insert one, every 30 days for 3 years. He saw a vet every single month for 3 years, and no one helped him. I requested all of his back office records from insert corporate hospital. They are shameful. I have never been so hurt, so angry. I told them in April 2019 that he had a very faint, barely audible murmur, a grade 1. The next I heard was February 2020, so 8 months later. A vet came out and talked to me about the murmur, said it was a grade 2, but nothing to worry about. He had even recorded it for me to hear. Nothing to worry about, just keep an eye on it. The back office records showed on that visit the doctor documented a diagnosis of a grade 3 murmur, even though said 2, with left side insufficiency, machinist in sound, and an arrhythmia. Didn't tell the owner any of that. A few months later, a grade 4 murmur was documented. Another visit, noted an arrhythmia. All of this time, and not a single corporate vet told me. He was on the best idiotic wellness plan offered. X-rays and EKG were available to him. None were offered. His last blood panel showed elevated liver values. The doctor said, "Don't worry about it." I began raising concerns last spring and summer of 2021. All were dismissed. This story sounds like I made it up. It's unbelievable to me. I am so angry and so bleep bleep sad. They knew he had heart disease. No one treated him, and no one told me. His own doctor did nothing. Unbelievable. I will never understand it. We haven't seen a cardiologist. I'm still considering it, as our hospice vet suggested it may help. For some reason, the entire city where we live, which is a large city, has only 2 or 3 cardiologists. One with a different corporate vet was on maternity leave, and another not able to see patients due to a non-compete after leaving corporate hospital. I hate corporate hospital and wouldn't go there anyway. The hospice vet has offered a referral to a cardiologist in a city in another state. If money weren't an issue, I'd be there in a second. I resigned from my position at a law firm December 30th, 2021. How do you cope and deal with your sweet King Charles heart disease? It's such an awful illness. Goodness, this is long. You're busy. I'll sign off. Thank you for taking the time to get this far. So, very sad story. And this is why I tell you, get copies of the records, get them emailed, get them sent by, take a picture and send me a message, get a photocopy mailed to you. I don't care how you get them. Get copies of the exams, get copies of the records, get copies of the lab work. Look at them yourself, read them, question. This dog had a problem for years, and she was told, don't worry about it until he's in failure in the emergency room, which may or may not have been preventable, but hello, it was probably very expensive to be in the emergency room, but it's just not fair. So it is critical. It is critical. And this is why we spend, this is my company's focus, educating pet parents. That's why we make courses on longevity. We make courses on reading lab work. We write books on, how to find a veterinarian, how to talk to your veterinarian, how to deal with this stuff. You got to be an advocate, and this goes for your own health too. I have to say that one of the things I love is we are part of the Wake Med system, which is actually not one of the highest ranked medical systems in the state. We ended up there because that's where they took my mom in the ambulance with her first little disaster. They did a great job. They were wonderful. But we have an online portal. All of our lab work goes in there. All of the doctor's notes go in there. Everything is there for us to see. We don't even have to ask for it. It's just there. So it's great. If my mom or Hugh or I get lab work done, it's there. I can look at it and go, Why is that abnormal? Maybe we should do something about that. Ooh, guess I should have fasted when they told me to. Those sorts of things. So it is really, really, oh yeah, Lisa, you're on my, Misaki, you are on my list for today. I just haven't gotten there yet. I did get that message. Thanks for the reminder. So, really, really important that you guys ask for all that stuff. Keep it in a binder, keep it in a digital file. I don't care, but ask for that stuff. If she had these notes saying that it was a grade 2, it was a grade 3, that there were arrhythmias, something could have been done sooner. Luckily, her dog's doing well, and through a bunch of emails back and forth, I recommended that she ask her veterinarian about getting torsemide instead of the furosemide, because that has been what took Stewie to where he is now. He was given a 3-month expiration date over a year ago. He's still kicking. And when she asked her hospice veterinarian about it, the veterinarian said, I've never heard of that medication. I don't know anything about it. But kudos to the veterinarian, because she did her research and came back to the owner and said, yes, this sounds like this could work, and was willing to prescribe it. So I'm still waiting to see how that goes for her, because I think she's just starting it today maybe. So we'll see how that goes, but it's been a game changer for our guys, and I know that a lot of the dogs in the Mighty Hearts community, it was a game changer for them as well. So anyway, just another one of those sad stories, and I see these every day. I had a conversation with someone that I can't really mention who it is, because it's a big battle that's being fought. But this was one of the things that we were discussing, that some of the medications that are used on particularly flea, tick, heartworm preventatives that are used on our pets, the veterinarian gives it in the office without asking your permission, without telling you what the potential side effects are. Once they put an injection into your dog that's going to last for 6 to 12 months, you can't get it back out. And if they don't tell you, they're supposed to give you a client handout form before they give it that tells you all the potential side effects. I have yet to talk to anybody who actually got that piece of paper handed to them before the injection was given. And the same thing with a lot of these oral products. So it's up to you guys to be your pet's advocates. Be your pet's advocate. So I know I'm preaching to the choir on this page, but love you guys. Let me see if I can get you some music to, barking to make your dogs crazy. I know it does make some of your dogs crazy. All right, so tomorrow will be noon with Billy Hookman. Looking forward to that conversation. The rest of the week, I don't know. It's a crazy week. I'll figure it out. Have a great evening, everyone.